Good afternoon and welcome to Conversations on Showing Up for Kids. My name is Tim Markle. I'm director of the Southern Regional Center for Children and Youth with Special Healthcare Needs. I also work with the Youth Health Transition Initiative. And so my worlds get to collide today. As our conversations, we are going to be joined with Louise Wilson, who's the Wisconsin Department of Public Instruction school nurse consultant. We thought it would be a great idea to have this discussion about what could be the overall role of school nurses in helping our kids with special health care needs and disabilities, but also how could they be part of successfully transitioning our students to the adult life? Transition is a really complicated thing. And so we welcome Louise. Usually we're meeting in a coffee shop somewhere, which is much better coffee than I get here because they closed the coffee shop here. So I'm really sad. It's really, if I don't bring it, I don't get it. It's really sad. So Louise, welcome. Glad you are here. It's excited to talk about school nursing and transition. And this is just a really interesting topic to me. So thanks for being here.
Glad to be here. And as you know, I'm passionate about school nursing and what school nurses can do for kids. So glad to speak about school nursing to anyone or anytime.
Well, and we appreciate it because, I mean, you know that I feel like one of the missing components sometimes, in my view, is the fact that there are schools that have a medical professional on staff, school nurses, who sometimes aren't involved in planning how to help this child be successful in school, when one of their barriers is understanding their disability and understanding the medical side of it. So how do you see the role of school nurses? What are they there for?
Well, school nurses really are there to be the bridge between health and education. They are really I thought you were going to ask me about my role first, so I'm thrown off, Tim.
If you would like, I can.
You got to go through the script.
I definitely can.
Tim, go through the script because it'll flow, and then I can I can go off record.
So Louise, you're the DP, you're the Department of Public Instruction school nurse consultant. What do you do?
Right.
What's your role? I appreciate that
because I don't want to repeat myself so many different times, and I've got a little script going here. So I'm very versed at going off the cuff. Yeah. Anyways, so first of all, I really when I refer to my position, and this is really what talks about it, because there really isn't any official title for my position. I refer to my position as the school nurse / health services consultant, because I not only support school nursing, but the entire gamut of school health services in school. So the state school nurse health services consultant position really is an awesome role, one that I have literally aspired to for many, many years before it became the right time in my life to apply for the position. So the school nursing health services consultant is really the face of health services here at the Department of Public Instruction. We do have some licensed nutritionists. There is a consultant that answers questions to OTs and PTs and speech and language professionals. There are also consultants that have expertise in mental health here at the Department of Public Instruction, but really, as the pandemic really made it abundantly clear, the school nursing health services consultant is really the only person working on health and clinical health and the chronic health needs and the acute health care needs of students other than mental health. So it's very clear that we do that. So as the school nurse consultant at the Department of Public Instruction, I provide statewide leadership in the areas of school health, students' physical and mental health, school nursing, and student health services in general. So my role makes me responsible for state level policy development, resource development, and informing legislation in the areas of nursing practice, health promotion, and wellness. In addition, I provide consultation and technical assistance to school personnel, community providers, and family members regarding the provision of school health services. And I would note, so part of my resume is that I am currently the president of the National Association of State School Nurse Consultants. And we do know that there are some states that don't have a state school nurse consultant. So there isn't anybody in those positions who can really provide that kind of statewide leadership, not only to the school nurses, but to the schools, but to the families, and also, to legislators and other organizations. So really, in summary, what my position does is that I collaborate and serve as the health liaison within the Department of Public Instruction. Other state school nurse consultants might work actually out of the Department of Health Services. And there are a couple states that actually have a consultant in both the Department of Education and the Department of Health Services, which I would love that model here in Wisconsin, but just not happening. But I also then am the liaison then with other state agencies, state and national committees, community-based organizations such as Prevent Blindness and others, and then all the Wisconsin schools and communities. And basically my job is to promote health and wellness, reduce health disparities, and prevent chronic disease in children and staff. And so I work on all those different things. So that's really what I do as a school nurse consultant.
What was I supposed to ask you next?
You had something about, according to the interagency agreement on transition, you were going to do some kind of interesting question on that.
I've been looking for my notes, Louise, and I have lost them.
Do you want me to read the question you sent me?
Yes, please. Or put it in the chat. This is
well, here, okay, let's see if I can copy it and put it into the chat. I got my notes here going here. Copy. Let me just, I'll just do that.
I am going to continue to look, because I know I usually am not much more together, but I'm a little more together.
It's in the chat.
Okay, thank you. Wow, these are really good questions.
Well, that's why I want to answer them.
Yeah, no, I'm brilliant, no doubt about it.
Yeah.
So yeah, let's talk about this interagency agreement, because this is the first year that the interagency agreement included children and youth with special health care needs in it. Usually it's been a very much an agreement between DPI and then DHS, and the part of DHS that does long-term care and supports, and children's long-term care and supports, and then DVR. And we've been talking with DHS to say, look, we have all these kiddos out here that we can support these parents, so we can help them, and we want to be part of the conversation. And so they put it in this year. So what the interagency agreement says is that youth with medical conditions that require management need health transition goals included in their IEPs to prepare them to be responsible for their own health condition in the workplace and independent living. This includes the ability to share information about the condition, seek appropriate care when needed, and instruct others how to assist in a medical emergency. In my mind, this has nurse written all over it. Mm-hmm. as someone who could be an expert in helping these things happen. So how do you think school nurses can play a role in successfully transferring these students to share information about their condition, seek appropriate care when needed, and instruct others how to assist in a medical emergency? Transition's so much bigger than that, but these are the three things that are in the interagency agreement. And so I figured we could start there, and then I could begin dreaming.
Yeah. No, I like the question, and that's why I wanted to ask it. I really think that and I'll probably repeat this myself a few different times, because I am a great advocate for school nurses and school nursing in general. But I really think that the school nurse and the value they bring to student health and education is often misunderstood and overlooked, and that's why they're not included. School nurses, again, really are the bridge between the health and educational systems. They understand both systems, and they can help really students and families navigate those systems. And truly, they are the only person that would sit on the educational team, and anybody from somebody's medical team that can do that. They are the only person that has that expertise and sit on that bridge. So they're also the only person on the educational side of the team that know that what the healthcare system is going to look like for that student once they leave school, and what those kind of needs are, and what the student might have to know, not only just to live their life, but also to navigate the healthcare system, when they, hopefully it might be independent, though I know, a lot of students will never live independently, or, will be under the care of their family, or have some kind of that. But again, we're the only people that really understand that. And again, we may not be experts in exactly what, different care systems are, but we can anticipate the challenges that students are going to have due to their health condition and disability. And then we can make sure then that there's some self-care skills built into the IEP, and if that's appropriate for the student. Because again, for some students, learning to be independent or of either their parents or their living situation, or be independent to take care of their medical condition, may be an appropriate goal, and for some it may not, or they might be for part of their health condition and not for other parts of their health condition. So
yeah, because there's a lot of health conditions that can get really complex, but we definitely want each student to have as much sense of agency, of self-determination, of self-advocacy as they possibly can. And I think to be your advocate, you have to understand what's going on in your body, and you have to understand your condition, whether there's a disability or not. You need to understand that condition. And so I could definitely see the role of school nurses in helping students to learn about their condition and their disability, because like you said, they're that bridge. I like that. I like that idea. So are school nurses allowed to be part of an IEP team?
Yeah, definitely they're allowed. And I often I spend a lot of time, as I said, I kind of advocate for school nurses. I spend a lot of time telling school nurses that they should be at the team team and in those meetings, and also school administrators or anybody else, that they should be really vital and included as part of the team, because besides being the team member really that has the most knowledge, besides the parents, about that particular health condition of the student, or their disability, they're the team member that can then translate how that condition affects the student's ability to function in school and learn. And you had kind of mentioned that, beforehand. That's really, the kind of the crux of what an IEP does, is helps the student. You look at their disability and how that, and a learning disability, but in this sense, we're talking about a health disability of some sort, or a physical disability of some sort, and how does that affect the students. So again, teachers can are able to identify and know they understand the gaps in a student's learning, and what students will need to learn to do whatever transition to post high school. But it's really school nurses that can explain what it is about that health condition that contributes to that educational gap, or to that learning gap, or them not being able to do that. So when I do professional development for school nurses on their role on special education and how and where to document, I often use a made up case study as an example. And I use one for example of a student that has seizures. And so again, as I explained to them, just knowing that a student experiences seizures, and saying, oh yeah, the student has seizures, doesn't translate into knowing how that affects the student's function in school. So I'm going to read an example that I give school nurses about how to document the effects of a disability in an IEP. So here's the example I would give them as what they can document. And of course, I've given them a case study and a lot of information about the student named Chris. So Chris's frequent nighttime seizures cause fatigue. Chris is unable to attend school on time 1 or 2 days per week and has missed a significant amount of math and reading. When at school, Chris is unfocused and he states he is often confused about what is happening in the classroom. It is possible Chris is experiencing absence seizures while in school. His family and medical professionals are working to diagnose and treat. When having an absence seizure, Chris misses the instruction that has occurred and needs the material repeated. His sleep deprivation affects his memory and ability to process information. And again, that's from the nursing world and the perspective and blending the two. The teacher just knows he's not doing very good in math and reading, and he doesn't seem to be paying attention, and he, seems unfocused and is unconcerned that he's not paying attention. But again, when you're hearing what the school nurse is putting all those things together, really explains that, and that's one of the importance of having a school nurse on the team. So again, school nurses bring value to the IEP team if they're in attendance. As I've mentioned before, school nurses bridge the both systems, health and education, but we're also translators of health and education jargon and the thought processes of each of the systems. And I think that's really important. So I know that I continue to experience this translation role in my role, even as a state consultant. When I collaborate with other agencies and other organizations, I help explain how this will affect schools in general, the health of students, the school nurses, and other health support staff that are trying to optimize student health and ability to be successful in school. And the pandemic was a perfect example of that. DHS or CDC would say, here's what we're going to do to prevent infection. And then I would go back to DHS and said, yeah, but here's the reality of, what school districts look like, the not having hand sanitizer, they have lunch breaks, they have, actually one of my very first meetings was with somebody at DHS who had no idea how school lunch programs ran, and if they shut down, if schools are going to be shut down, what effect that would have. And so what my explanation of sharing with them about, that schools provide a huge source of nutrition for students. So again, as a school nurse, I think, well, that seemed like a no-brainer. Doctors and healthcare and public health people should understand this, but they don't. And then on the same side, teachers think, well, people should understand this about education, but they don't. And school nurses are the people that do, and can bridge that. So I think that's really helpful.
Now, that also brings to mind, as you talk about, like lunch, how valuable like school nurses working in tandem with like an occupational therapist or physical therapist could be to help that child be included in that lunchroom experience. And that's a skill set that maybe the lunch monitor or the teacher, that may not be in their background. But there is that medical professional school nurse who could sit there and say, okay, this is what this child is eating. This is if they have complications, and again, working with a therapist, it seems to me that that's a role too, of trying to help them with special healthcare needs be included in the life of the school.
Well, and school nurses get very experienced working with and training and explaining things to people who don't get health. And so it's kind of fascinating, actually, when I work with healthcare professionals, and I'm on a lot of committees, that the people there are talking about asthma, and they're doctors, or they're talking about diabetes, or they're talking about public health and that. And again, they think like, okay, everybody sees and thinks and has this background knowledge. And school nurses realize that, no, we're working with lay staff who don't. And very early in my experience, because I'm an older person and an older nurse, working with colleagues at that time, said that, of the age where you kind of like, you either became, it's a little bit before me of my time, but where you either became a nurse or you became a teacher if you're a woman, kind of thing. And people would tell me, Louise, I did not go into teaching to learn how to catheterize a student. That was not my thing. So, we get that all the time. And so we understand those barriers and what they're thinking of. And so we become very expert at breaking things down, explaining things in lay terms, and explaining, what the student's need is and how you can help meet that student's needs. So again, I really think that, and then advocating for that child to be in the lunchroom. They don't have to be, fed separately, anything. And yes, it may, you know, I guess gross for a lot, other terms that, oh, it's really gross when they're, doing this or whatever. Yeah, maybe, but here's some things, and really explaining and advocating and say, this is really the child's right. And this is what they get out of it. And then also explaining, what other students, if you approach it correctly, this is what other students can get from the experience too, by having that child be in the lunchroom and be fed, even though it might not, be the, at first the most pleasant thing, but being able to explain that, because again, as a school nurse, was blessed many times to have been in a situation where, a parent or an adult comes up to a situation and says, ugh, and their child says, oh no, Johnny's just like me, because and we've done that, and the school nurse told me this, the teacher, and this is what we do, and look here, mom, I can push him, in the wheelchair, and the kid being the teacher and showing the adult, what is the compassionate, what's the humane, what's the way to treat and interact with it, and being accepting, because kids generally have really good hearts and are accepting, unless us adults teach them otherwise. So
yeah, that's that whole sense of exposure helps compassion. It's one thing to say I'm compassionate about everybody, but another thing when you're in a situation where you're called to be compassionate. And I think our kids are a lot better at being compassionate than some of the adults in my life. So I very much agree that sometimes they get it and we're sitting there going, oh, maybe I just need to back off. Is that the best natural supports are those other students in the class, and if the school nurse can work with the other students, provide maybe a certain level of intervention and care so they can be included, and then if it goes here, then okay, yeah, let's bring in an outside source. But there's so much that can be done within student to student. So how else do you have other ideas about how school nurses could help write goals around a transition plan? So specifically thinking about those times where we have this child who's going to leave school, whether it's at 18 or whether they go to the 18 to 21-year-old program, that support structure is going to disappear. And for some families, that's a really big support structure. And so we're always looking and asking schools to say, okay, in Wisconsin, we start at 14. And say, okay, you got to start thinking about transition. How is this child going to succeed outside of high school? And a lot of times we see IEPs that are really strong on how they're going to get a job, or, they're going to go on to higher education, and not so much on some of those more foundational skills, like around how are they going to manage their own healthcare to the extent that they can? Where are they going to get their healthcare? And so, I, of course, because of my position, think there's a place in the IEP for some of these health goals. How could school nurses help write goals in a transition plan?
Yeah, so I think that's a great point. And I would say that the Department of Education is doing a lot of training with schools to really look at the whole child. And again, not just looking at their educational needs, but really looking at that whole child. And that's why I really push to have school nurses there, and then really help explain how that health condition does affect their education, and how that it affects their whole, what is termed on the IEP is parents who would, know that functional performance, section, really how that disability affects their functional performance, and then being able to translate that into some language, which is, that example I gave. But yeah, so I think that's really, so if people are looking at that and looking at the child holistically, then they need to be addressing the health needs too, because that's part of the child and how they go to leave. And so, yeah, so there can be goals, and there can be, health goals, there can be goals written into the IEP. Also, what I would explain to like school nurses and team members is that school nurses also write nursing care plans for students with complex healthcare needs, just like nurses write health plans for patients in hospitals, and they have, individual health nursing care plans for patients and their unique needs and conditions. So, nurses are used to writing care plans and that. These individualized healthcare plans, or school nurses call them IHPs. May have some student goals, and some of them may be directed towards transitioning or more independence. And I know that those outside of school nursing profession, and even some school nurses, are still confused and don't use the term IHP correctly, but that's my soapbox and thing that I'm putting my stake in the ground as a school consultant. I'm going to change the language and culture around that, at least in Wisconsin, and get people to understand that the IHP is a nursing care plan for nurses to document the nursing process and their professional responsibilities. And part of our professional responsibilities is to have a goal for a student, a health goal or independence goal. So that's where that goal can be written. But if it is something that, like a self care skill, which again is what's going to be needed for transitioning, it can also become in the IEP, and it really should be part of the IEP, because it's not just necessarily the school nurse who's working on that. I'm thinking, a very easy example is a student who has diabetes, who's learning to self-manage. It's not just the school nurse who's working with that student and telling them, start off, maybe could do their own finger pokes and read. And then the school nurse, yes, is working with them with carb counting, but the teachers and everybody else works around that. And the teacher who is helping that student, saying, oh, and pointing out, did you recognize this is the first time you told me that you, were having symptoms that were on the list of the emergency care plan, as you were talking about, that talks about hypoglycemia. Now, of course, they're not going to do that until they've sent the student down to the school office, or given them, or followed the emergency plan and given them the fast acting glucose. But as part of that, again, if the student had an IEP, that would be part of it. And again, it's a team effort. So learning to recognize their symptoms of hypoglycemia, being able to be more having higher skill levels as the years progress, so that by the time they leave for high school, again, unless the disability is such, and there's some co-disability, that they are going to be needed to be in a more protective living situation, or still living with family, they're going to be independent. They need to have those skills. And students without IEPs, sometimes school nurses have to, we again would write that into our health plan and goal, because we need to move that student without an IEP and the family into that. But if they have an IEP, that those things can certainly be written into the IEP. Yeah.
So do you provide guidance to school? And so off script, so sorry.
Yeah, no, that's fine.
Do you provide guidance to school nurses on what like a transition IHP might look like? Is there some guidance about how to help write transitional health plan goals?
I provide a little bit, mostly when I'm talking with school nurses now, is to make that distinction of between what an IHP is and then what kind of goals are in an IEP. And I do give examples. I don't know that I've probably done enough at this time to talk about that. I know, Tim, that you're going to be presenting at the school nurse conference here soon, and so I'm hoping that they'll get a little bit more and get school nurses, unfortunately, school nurses have to always be the one that are pushing other people to say, here's what we can offer you, here's what we can offer the student. People don't come and recognize, like, hey, could you do this? Or, hey, I understand this is a skill or something that you could offer students. School nurses have to push up to get involved in IEPs and that. So I think they need to understand some of that first, so that they can do some of the pushing. But yeah, I mean, I do provide again, in language, and really it's about understanding what how any health condition impacts the student's disability. And then from an again, this is just a nurse thing. We're looking at goals and nursing in itself is a continuum of health, and health being on a continuum, and independence is always, on one end of the continuum that you're trying to move people towards, as of being as healthy as possible. We're not a disease model, and we're not like a cure model. It's just being healthier, and being healthier is being able to, be more involved. And again, the kids that we work with, huge gamut of someone who, who totally is going to be, dependent on others, and those that can really have a pretty good level of self-management if they're taught the skills. And so and again, some of that, because of how school nurses are staffed, are going to do some of the skills, but some of those skills are going to be taught by the special education teacher or the regular ed teacher, depending on what the student's IEP and who's spending time with the student. But learning to, you can't count carbs until you know how to do math, and the different things like that. So yeah, so it should be a joint effort. Yeah,
great way to make math matter.
Yes, exactly.
Really
And motivating
and
motivating. And I can't tell you the number of times where I said to school nurses where you can use that. You could get your driver's license if you had your diabetes better under control, or your seizures better under control, or things like that. So some of those developmentally appropriate type things are great motivators too, which again, I don't know why educators don't seem to understand that, but nurses do. I don't know, maybe we're just a little bit, particularly at the high school level. I don't think education staff, it might change a little bit, but I don't think they're as developmentally or grounded in child development as much as elementary kids teachers, and of course kindergarten teachers are the best, that really into developmental things. But at high school, they start kind of treating everybody, like the ninth graders should act like an 18-year-old, which isn't developmentally appropriate and not going to happen. But I think sometimes educators get into that, and maybe it's because they have 9th through 12th graders in a lot of their classes or something. I don't know. But anyways, but school nurses automatically think about that because we're nurses. So
right. And that's part of health, is being developmentally appropriate of where I should be at, and looking at how can I get to that level of function that is going to be healthy for me. And that I agree that health is just such an individualized rating scale, I guess, that you really need to know the person to be able to talk to them about their health and what does healthy mean for them, instead of using the universal scale of health. So you mentioned that it seems school nurses have to push up a lot to be involved. And that strikes me as one of the barriers to nurses being involved in special education, is that it almost feels like they have to force their way in. Whereas in my mind, they should be at that table, because it obviously is something that's affecting this kid's health, whether that's their mental health or their physical health, or that something is going on with their health, to help them need that extra support that general ed students won't need. They need extra support. So what are some of the other barriers from nurses being involved in special education?
Well, I think really that it boils down to two different things. When I talk to people, I really think that there's a misunderstanding and underappreciation of the skill set of nurses who work in schools. There's this thought process, and I used to have a national presenter who used to give a presentation on any mom will do. And people think that if you're a mom, you have the same skill set as a nurse. You just know that kind of information. I mean, I've had administrators who felt like, you don't know anything different. And I could give some really great examples of. I even had a nursing student one time who then afterwards I said, you're not only just nursing student, but you're becoming a nurse because you recognize these things and did this, and the lay staff who didn't. So just clear examples of obviously, and when I say it out loud, it just seems like a no-brainer. Duh. School nurses do have a different skill set. We've gone to school for 2 or 4 years, and have learned different things. We have that, but but I hear that all the time, and we hear about that in delegation. Or again, you can just train somebody to do a procedure, but it's not just doing the procedure; it's all the other things, that go behind the scenes. So that's a barrier, I think, is just the underappreciation and misunderstanding of that. And then really, like in Wisconsin in particular, but there's other states that this is an issue for, is really the lack of school nurses, or that they're working at an impossible student to school nurse ratios, working in multiple buildings, maybe in multiple towns. I know when I first started, I was working at 12 different schools in 2 different towns, 20 miles apart. And it's really hard to be involved in IEP meetings. And so what I do to parents whenever I talk to them, and they'll ask me about that, is I encourage them, first of all, to check with your school administrator that you're talking to, like the pupil services director is usually in charge of the special ed. I ask, do they have a school nurse? So find out if there's a school nurse, because I really firmly believe that one of the most important roles is that we are health advocates for students in the school system. So parents can request that the school nurse be part of the IEP team. And I hear over and over from school nurses as I'm in this position, and I know from my own experience that oftentimes school nurses don't hear about a meeting until just a few days ahead, a few hours, a couple minutes before the meeting, after the meeting has occurred. So they just really aren't invited. And from my viewpoint, that just shouldn't happen. It doesn't, give the child fate because you didn't have anybody who's qualified there to discuss health conditions. Even if they know that there's a health condition, no one was qualified to talk about it. A school psychologist is not qualified to talk about diabetes or seizures, or sickle cell anemia, or any other, cerebral palsy, and not really. And there might be an OT, PT that can, talk about a certain part of a cerebral palsy, but not again from the whole aspect. So again, you're kind of denying the person's fate, and again, just not having a school nurse there, they're just missing out. The student and the family and parents are missing out on a strong advocate if the school nurse isn't there.
So I know we have a couple of questions in the chat. And I'm assuming because you've been chatting, you're able to see those, Louise. Do you want to go ahead and
answer them? So I'm just going to read it so that I don't know if people get the chat when they have recording, but do you think it would be helpful if parent caregivers tied health goals to post-secondary goals like employment or college, attending college? I really do, because I think as a parent, I think the parent is thinking like, how is my kid going to get a job, or how are they going to go to college with this health condition? Because they understand. I mean, parents live and breathe the full gamut, the whole child concept. And teachers, unfortunately, are thinking just about education goals. I've got to teach them enough math. I've got to teach them this. I think they're getting a little bit more skills based. And again, a lot of the students who have IEPs, and some of them with the most critical health conditions, might function at a level that there's these certain things. But parents think about that, and that's just how nurses think. I mean, that we don't peg things, and because we work in both systems, we're not tied and don't have our mindset on just educational goals. So I think that would be very, very helpful to think about, okay, really, and I guess what I would encourage school nurses, if I actually did a presentation to them on this, was to really just think about, you got this child, how are they going to go out and live in the world? And so what kinds of things and what skills are they going to need to live in this world? And your, part of this is to, how their health impacts, because it's not just self-help skills. It's about, how, again, how does the fact that you might have seizures or that you're not controlled going to affect your ability to, have a driver's license? Or how might this health condition affect your ability to become a father or mother someday? Or, just different things like that. So yes, I truly do think that. And then how much do school nurses educate students and their caregivers about the health system, like changes in privacy at age 12? I don't think school nurses probably do that at all. Or very rarely. And I'm trying to think that, one, I think because they don't have those type of interactions with parents at those times. I think if a privacy issue or something like that comes up, I think school nurses would answer those questions, but I don't think they have that kind of interaction with parents. And the fact is that school nurses do work for schools, so we work under and the information exchange and pupil records is under FERPA and not HIPAA. So depending on the state, there might be some privacy issues that might apply to like the healthcare system that don't apply to the school system. Now, school nurses can explain that to parents, and that's often we get caught in the middle. And I answer a lot of questions for school nurses who are caught in the middle because they come from a system, they fully understand the healthcare system confidentiality, and they don't understand why FERPA allows this kind of exchange of information, or what they can share with or without, parent permission. And so sometimes school nurses have to explain that to parents. Yeah.
So there's another, so Quanlin, thank you. I was just going to say, hey, any questions, put them into the chat. So are you aware of GOT Transition 6 core elements?
I am not. I have to say I am not. So when you were introducing that, Tim, no, send those to me, because I would really like to know that. And just your introduction, I really wasn't aware of the history of how the department, and you and I have talked about different things, but I really wasn't aware of how the history of how some of these changes and the increase in trying to have this happen came about. So yeah.
And that's the other. So Quandelin, I have done a poor job on behalf of Wisconsin of introducing GOT Transition into the school nursing realm, and I think that's a great idea. So yes, I will be sharing the 6 core elements, because I think about so they're basically set up of do you have an idea about how you're going to do transition? Okay, then what are the steps in doing transition, and how are you going to make sure that everybody is doing those steps? How do you institutionalize it, and how are you measuring it, with the goal being, all right, when the person is done with transition, they're functional in the new system, in the adult system.
Well, so what I would say, just from that little bit of introduction, is nurses and school nurses are experts in goal setting and measuring. My pupil services colleagues used to laugh because when people would be asked like, oh, how's this going on? And I say, oh, I have data on that. And they say, yeah, sure you do, Louise, because you're the school nurse. And the school psychologist and the school social worker, school counselors had no idea, what if something was a problem or what was happening with students. But school nurses collect data, and we use data. And so I think, we're experts at setting goals for different things. So I think that they would be really helpful in that. So I do think, so share that with me, and I can
absolutely
have some little different things. And maybe before you talk at the school nurse conference, I can get a little feedback. Though I have had a really short timetable, because I'm leaving for conference before my vacation, and then returning in just a couple days from vacation before the conference. But maybe we can connect, and I can give you some pointers to put into your,
I can at least start by pointing you to where those are, and you can look at them and think about them through the school nursing lens. And I think that would be a really fascinating discussion, whether for this school nurse conference or down the road.
Future, and I would just say that anybody listening to this is that, again, not every state has a state school nurse consultant. But if you were to Google, and let me see if I can find the. I don't know, where's my I'll try to find the website. Yep, here I'm gonna put this in, and then I don't know if you send out notes afterwards.
If I feel ambitious enough.
Okay, well, otherwise, here is the National Association of State School Nurse Consultants webpage, and you can look there and find out if your state has a school nurse consultant, and who that person would be, and how to contact them. So I would encourage people to do that, and just see where this conversation is in their state too, and probably get some information on that. How do you suggest school nurses are involved with students who have special health care needs but may not have an IEP. Again, school nurses, and this is a whole nother presentation, but they not only write their individualized healthcare plan, which is a nursing care plan, and again, that's detailed, it's using the nursing process. So a lot of school nurses, in at least like in Wisconsin, when our ratio is you've got 1 to 2,000 students, don't necessarily have health plans on all the students, but they do pretty much, again, if a school even has a school nurse, because we have lots of schools who don't have a school nurse in Wisconsin, we do write emergency action plans. So that is, a little bit of being able to address the student's health needs, I guess, addressing the student health needs by keeping them alive while they're in school. So that, and then most of Wisconsin school nurses probably write what I call is kind of a generic student health plan, because it's not a nursing care plan. It doesn't use the nursing process, but it explains beyond the emergency action plan, which is really a see this, do that emergency type thing, but explain a little bit more about healthcare needs. And so that's how, a school nurse would get involved. So there's lots of students. And again, when I do presentations, you've got the little bubble of the concentric circles of students with IEPs and 504s, and then the regular ed students, and school nurses take care of all those students. And so, and all of them can have health needs. And so, school nurses would help write health plans, so that, again, basically what they're doing is translating what is that student's health need and what could happen in school, and what do we need to keep them safe in school, is the primary thing. Because I used to say that our mission was to keep kids alive and alive until the end of the school day, and then safe, and then remove barriers so that they can learn are three important things. But school nurses are always triaging, so keeping them alive for the day is the first thing. Then helping them, and then helping them learn, and then also then helping them become better people and citizens. And part of that is then that, and that's what transition's all about. So
right.
Yeah.
And it seems to me from what you've described is that there are some spaces that are naturally occurring within school nursing where we could look at developing what could be in that transition IHP. What would a transition emergency action plan look like, where we're planning for how are you going to stay safe if emergency happens when you're not at school, when you're over 18, or when you're not coming to school every day? Do you know what to do in case of emergency? Then is, I see that as a space, along with then, the same sort of thing with the transitional student health plan. Is it's not always going to be contained in this place here in this school. How are you going to take care of all these important things outside of school? So it looks like there's space.
Definitely. And, and a student could take their emergency action plan that they have at school and give it to their employer, be it a, a youth employer, or their, after they graduate, employer, and say, hey, this is what my needs are. But hopefully the student will learn also how to articulate that themselves. So.
Absolutely. And so, I mean, I'm a proponent of school nurses. I post on Facebook whenever it's School Nurse Month, and I make sure everybody says hi, and, hug, elbow, fist, whatever you want to do, high five your school nurse, because for our families, they are just vital to our children's success. And so thank you for what you're doing with the Wisconsin school nurses and with the national school nurses. And I love the fact that you're part of this conversation. Thank you for taking time out to be here today. Really do appreciate it. And let's move forward for the rest of our day. So thank you so much, Louise. Really do
welcome.
appreciate it. Have a great day.
Bye-bye.